Most people don't realize this, but your nails can reveal deadly diseases long before you feel any real symptoms. Right now, as you're watching this, there are people sitting comfortably, thinking everything is fine, while their bodies are quietly signaling serious problems through their fingernails. In the next few moments, you'll discover 7 critical warning signs hiding in plain sight, signs that could mean heart disease, liver failure, or even cancer. And here's the shocking part. Studies have shown that subtle nail changes can appear months before major diagnosis, yet most people ignore them completely. I'm Dr. Jake Miller, and in over 20 years of treating patients, I've seen one heartbreaking pattern repeat itself over and over again. People miss the early signs, not because they aren't there, but because nobody told them where to look. Here's the truth nobody tells you. Your nails are one of the fastest ways your body communicates internal distress. And this is something most seniors will never hear from their own doctor unless it's already too late. Let's start with the first sign. Most people notice pale nails and assume it's just aging or maybe a lack of vitamins. That assumption is exactly what costs people their lives. Here's what's actually happening inside your body. When your nails lose their healthy pink tone, it often means your red blood cells are not carrying enough oxygen. This can point to anemia, but more dangerously, it can indicate heart failure or chronic kidney disease, where oxygen circulation is compromised. Here's the critical detail that separates this from something harmless. First, the nail bed looks almost white instead of pink. Second, you may notice fatigue that doesn't go away with rest. Third, your fingertips might feel cold, even in warm environments. If pale nails are combined with shortness of breath, that's not just aging. That's a conversation you need to have with your doctor this week, not next month, this week. Now you know about pale nails. But the next symptom is more dangerous. Most people see yellow nails and think it's a fungal infection. That assumption is exactly what costs people their lives. Here's what's actually happening inside your body. Yellowing nails can signal serious respiratory conditions, including chronic bronchitis or even diabetes affecting circulation and tissue health. Here's the critical detail that separates this from a simple infection. First, the nail becomes thick and slow growing. Second, it starts to curve more than usual. Third, there may be swelling in the surrounding skin. If your nails are turning yellow and you also experience persistent coughing or breathing issues, that's not just a nail problem. That's a conversation you need to have with your doctor this week. Before we go further, I need you to understand one thing. These signs are not random. They are warnings, and ignoring them gives disease more time to grow stronger. Most people notice vertical ridges in their nails and dismiss them as normal aging. That assumption is exactly what costs people their lives. Here's what's actually happening inside your body. While mild ridges can be harmless, deep, pronounced ridges can signal nutrient absorption issues or even autoimmune disorders affecting how your body regenerates cells. Here's the critical detail that separates this from harmless aging. First, the ridges become deeper over time. Second, the nail surface feels uneven or brittle. Third, you may notice hair thinning or skin dryness alongside it. If those patterns show up together, that's not just aging. That's a conversation you need to have with your doctor this week. Now listen carefully, because this one has a body count. Most people ignore dark lines under their nails, assuming they're bruises. That assumption is exactly what cost people their lives. Here's what's actually happening inside your body. A dark, vertical line could be a sign of melanoma, a deadly form of skin cancer that can develop under the nail. Here's the critical detail that separates this from a bruise. First, the line doesn't grow out with the nail. Second, it gets darker or wider over time. Third, it may spread to the skin around the nail. If you see that pattern, that's not a bruise. That's a conversation you need to have with your doctor within 24 hours, not a week from now. Hit subscribe right now if you're not already here, because what you're learning today could save your life or someone you love. Stay with me through all 7 of these, especially number 7. That one has never once been on any list most doctors share, and I'm going to show you exactly what it is before this video ends. Most people notice spoon-shaped nails and think it's just a weird genetic trait. That assumption is exactly what costs people their lives. Here's what's actually happening inside your body. When nails curve upward like a spoon, it often signals severe iron deficiency or even internal bleeding that's gone unnoticed. Here's the critical detail that separates this from something minor. First, the nail dips inward enough to hold a drop of water. Second, you feel constant weakness or dizziness. Third, your skin may appear unusually pale. If you see that combination, that's not harmless. That's a conversation you need to have with your doctor this week. Now you're starting to see the pattern, but it gets worse. Most people ignore clubbed nails, where the fingertips enlarge and nails curve downward. They think it's just how their hands are shaped. That assumption is exactly what costs people their lives. Here's what's actually happening inside your body. Clubbing is often linked to low oxygen levels in the blood, commonly caused by lung disease or even heart conditions. Here's the critical detail that separates this from normal variation. First, the angle between the nail and cuticle disappears. Second, the fingertips become rounded and swollen. Third, the nails feel spongy when pressed. If you notice these changes, that's not genetics. That's a conversation you need to have with your doctor immediately. Right now, as you watch this, there are people ignoring this exact sign, thinking it's nothing, while serious disease continues to progress silently. Most people notice brittle, cracking nails and blame dryness or soap. That assumption is exactly what costs people their lives. Here's what's actually happening inside your body. Brittle nails can signal thyroid dysfunction, where hormone imbalance disrupts how your body maintains healthy tissues. Here's the critical detail that separates this from everyday wear and tear. First, the nails split easily, even without trauma. Second, you may experience sudden weight changes. Third, your heart rate might feel irregular or faster than usual. If those signs appear together, that's not just dry nails. That's a conversation you need to have with your doctor this week. That insight could change what happens at your next appointment. But we're not done yet. Most people overlook white lines or spots on their nails, assuming they're from minor injuries. That assumption is exactly what costs people their lives. Here's what's actually happening inside your body. Persistent white lines across the nail can indicate liver disease or protein deficiency affecting your body's ability to repair itself. Here's the critical detail that separates this from harmless spots. First, the lines run horizontally across the nail. Second, they appear on multiple nails at once. Third, they don't disappear as the nail grows. If you see that pattern, that's not a simple injury. That's a conversation you need to have with your doctor this week. Before you close this video, I need 60 more seconds of your attention. Everything you've just learned comes down to one simple truth. Early detection changes everything. When these signs are caught early, treatment is often simpler, faster, and far more effective. But when ignored, when dismissed as nothing, that's when people end up in emergency rooms, wishing they had paid attention sooner. So here's exactly what you need to do next. Look at your nails right now, not later, right now. Write down every change you recognize, even if it seems small. Call your doctor and read that list out loud. Ask specifically for blood tests, oxygen level checks, or any screening that matches what you've seen. You're not being difficult. You're being the only person in that room fighting for your life. Because while you were treating the wrong thing, while you were assuming everything was fine, these diseases were buying themselves more time. And time is the one thing you don't get back. Like this video if you learned something new. Subscribe so you don't miss what could save your life next. Share this with someone you care about, because they might be ignoring these signs right now. And remember this. There's a specific combination of just 3 of these nail symptoms that almost always points to a serious underlying disease. I didn't tell you which combination today, but in the next video, I will.